Hey, I'm Dr. Susanna Bozzoni, and just want to have a little moment to talk about vaginal face cream. Yes, vaginal face. So what I'm talking about, of course, is vaginal estrogen that a lot of women use, and I love. That's fantastic for vaginal atrophy and other concerns, recurrent urinary tract infections, in perimenopause and postmenopause. This can be a wonderful thing and should be absolutely given to any woman that's having urinary genital symptoms of peri and postmenopause. And so there is some data to suggest that it can be beneficial to remove fine lines on your skin. And so that's really cool. It takes a few months for that to kick in. So many women are using vaginal estrogen on their skin now, just kind of a dot of that. And that's cool too. But I do want you to know that the typical vaginal estrogen that's prescribed and FDA approved actually has methylparabens and sodium lauryl sulfate in it. And while the data is not 100% clear that these are damaging or toxic substances, there are certainly some concerns about both of these substances, such that sodium lauryl sulfate is actually banned in Europe at this time, and multiple parabens, not methylparabens, to be clear. Okay, methylparabens is the one of the many parabens that are out there that are in the category of likely endocrine disrupting chemicals. So BPA, everything that was in those plastics, dioxins, other things that we are trying to often avoid in our skincare products, in our plastics, and all of these things that are in our environment. So methylparabens is one of the ingredients in the vaginal estrogen. So there is a way to get the vaginal estrogen if you want to try that trend out and see if that's helpful for you, but you can get it compounded without that. So just so that you know that, we have this huge absorptive center that is the skin, and in fact, parabens have been found in placenta, in breast milk, in urine of children and adults of all ages. Women tend to have higher levels of these. They are thought potentially to contribute to breast cancer. This has not been defined, so be clear, okay? More studies need to be done on this, but I am certainly of the belief that let's keep it out until we know that it is healthy and safe, as opposed to putting it in until it's been proven to be unsafe, which is kind of where we are in this country. So again, methylparabens is in your vaginal estrogen if it is a prescribed FDA approved formulation of that, as is sodium lauryl sulfate. So just be conscious of that. Make sure you are looking at your skincare products in general. This is often where we don't think about that because we're trying so hard to do all these wonderful things for our skin, but it is a huge absorptive center, and there's a lot of power that we have in choosing our products as much as you can to be as clean as possible. The Environmental Working Group is a great place where you can just see how your products are ranked on some of these ingredients we don't know a lot about, or sometimes we do know enough to be want to steer clear of them. I hope this is helpful information for you, and I hope that you stay well. Bye-bye.